Okay guys, welcome back to the channel. Listen, today we're going to dig into some hard topics, so get your thick skin out, okay? You might want to get a pen and paper as well, all right? We're going to get into some really good things today in regards to 3 of the top 5 most critical peer-reviewed studies on health issues today, all right? So again, for those who don't know me, my name is Jason Bankston, author of Have a Heal of a Time, where I teach people how to repair their immune system with a 6-month wellness program already in the book. And also my latest release, a children's book, Created for Greatness, Superfood Immunity. Very excited about that new release right now. Doing well. So listen, I want to talk to you today really quick, not going to keep you long at all, about 3 of the 5 top health studies out here about critical issues that's going on, right? And how to combat that, how it's affecting our immune system, and I would just say society as a whole, all right? We're going to dig into a few things here. So right into it, right? These studies, and I'm going to give you the links in below so you can look them up for yourself, because it's very important. Now, when they say peer reviewed, you can still have to take things with a grain of salt, right? Because you're looking at who is actually doing the reviewing, right? So today we're looking at the New England Journal of Medicine, right? We're looking at the JAMA, right? That's the Journal of American Medical Association, and also the BMJ, the British Medical Journal, right? So 3 top medical journals in the world, right? We are dealing with these issues in these studies, okay? So it says here, leading peer-reviewed studies today focus on critical global health concerns, specifically targeting the cardiovascular impacts of environmental microplastics, AI ethics and medicine, personalized oncology, and autoimmune breakthroughs. These publications highlight non-communicable diseases and environmental risk as our most pressing modern health threats, all right? So that non-communicable diseases, that's your cardiovascular disease, that's cancer, I would say some respiratory issues, you have your COPD, you have, your respiratory infection diseases, right? So you have those non-communicable diseases, and they actually are affecting women the most, all right? So let's get into it. We're gonna talk about it right now, okay? So number 1, we have from the New England Medical Journal, right, of Medicine, right? Environmental toxins and cardiovascular risk, okay? The study focuses the first direct evidence that microplastics and nanoplastics significantly increase the risk of myocardial infarction, stroke, and death in humans. Myocardial infarction, or MI, is just a heart attack, right? Cardiac arrest. So here we have where the microplastics are basically in everything. So again, remember, in my book, I tell you, you're gonna have to look at your lifestyle and your affinity with plastics and aluminum and metals, right? Your cooking ware, or changing your cooking ware to bamboo, right? And not getting the non-stick pans, right? Looking for ceramic pans, looking for different ways to reduce your plastic and metal intake. Instead of storing your food in plastic containers, using the glass containers, right? Even the fibers that from your clothes, right? Most of us wear, polyester and different plastics is what this really is, that we have as fibers for our clothing, So you have to reduce your microplastic footprint best you can. And then there's other ways I'm going to show you in a minute in regards to what you can eat, your diet, right, that can reverse some of these things, right? And not 100%. To be perfectly honest, it's not 100%. You have forever chemicals out here. So certain things are not going to get back to an optimum 100% level of health. It's just not feasible for the majority of our population, okay? So number 2, right? Number 2, our second study here is the global health span versus lifespan disparities, right? This study focuses and qualifies the global health span lifespan gap across 183 countries, highlighting how non-communicable diseases disproportionately cause life expectancy disparities and affect women. So we're looking at women are our mothers of the earth, right? Even whether they have a child naturally or not, they are our mothers of the earth. So these diseases like cardiac arrest, respiratory problems, and cancer, right? Breast cancer still being number one of the top 5 causes of chronic disease and death, according to the CDC. So we have to look at these things, right? We have to look at the fertility levels are lowering, right? Testosterone lowering in men, and we're having less children now, right? And then our women are under attack. So this is what I want to talk to you about, is that we are under attack. Long gone are the days where you can just simply say, oh, my health is, I eat what I eat and I kind of do what I do, and maybe I'll just take a few medications and pills. It's fine. Everything is good. I'm listening to the doctor tell me what to do. I'm not saying all doctors are going to not tell you the right thing what to do, but you have to use some self-autonomy and what you're actually doing with your own health. You need a program and a system for you and your family. Right? This is about generational health. We're all about the generational wealth. It's about generational health as well, right? So it's things you have to take control of, and that is your health, all right? So we're gonna go into here. So now look at number 3. Number 3, right? And you won't be a shocker here, and this is the BMJ, right? Mental health and the digital age, right? Study focus, systematic evaluations of contemporary trends in youth mental health, focusing on the impact of social media platforms on the behavioral and mental well-being of young adults. So our women, mothers of the earth, are being attacked. Our children having poor mental health due to social media and AI. And remember, I told you, got to reduce that screen time, reduce that TV, and watch the programming, right? In my last video, we talked about the reduce, eliminate, and incorporate, right? And those 3 things you can incorporate in regards to what your children are doing, because it's reducing their mental capacity to function in life. So our mothers of the earth are being attacked, our youth is being attacked, and the male testosterone and fertility is reducing. So I don't know about you, but can you see a few things going on here? All right, so we need to combat this. We need to take this as something that's very serious, actually, and not look at like, oh, it's just laissez-faire. Oh, well, we'll rely on the CDC and the World Health Organization to take care of us. And, the FDA is always going to approve, good things for us. So we have nothing to worry about, right? Is that correct? We already know the proof is in the pudding, as they say, right? So let's look at some things that we can do, starting with the first, the microplastics, right? We talked about the cooking ware, right? But you must understand that the microplastics are at the cellular level. So at the cellular level, you need a lot of antioxidants. You need a diet rich in antioxidants. Why? Because you need your immune system to kick in overdrive, more than you ever have in history, I would say. Because today this country is full of all types of plants where metals are spewing metals and toxic waste in the air. Our air quality is being diminished, right? So we need to actually do more than our grandparents used to do to combat these things, right? So because we're fighting a myriad of different things today than we were before, right? So it's important that you have a diet rich in antioxidants to reduce the inflammation on the cellular level. In my book, I talk about how your immune system is your first and last line of defense. It's your Army, Navy, Air Force, and Marines, all right? Shout out to all those that serve, all right? But at the end of the day, if your immune system military is not working, right, then it's not protecting your borders, foreign or domestic, right? And what happens is the gut government is the one that dictates policy on your immune system military, right? It helps it. So what you put into that gut feeds the policy, right? Feeds the agenda, right? And strengthens the immune system to bolster against inflammation and help with the cellular respiration of your body, because everything starts with your body cellularly. So you have to be very careful. So a diet rich in antioxidants, also a diet rich in soluble fiber and insoluble fiber, because those things have a chelating factor where they bind to different metals and plastics, and you can poop those things out. You can get rid of them. I don't know if you can get rid of all, to be perfectly honest. Like I said, we have forever chemicals in these microplastics. They are affecting us on a cellular level. So a diet rich in that, again, I like curcumin for turmeric. I like cayenne pepper, right? These are things that help clean the endothelial cells in your blood vessels, right? Also, we like the raw cacao. Now you have to be careful. A lot of this stuff has metals in it, but raw cacao, cinnamon also. Natural things, right? You have teas, moringa tea, right? You have holy basil teas, right? There's different things you can do to ingest, incorporate, so you can reverse these things, but you have to be very cognizant about what you're doing, right? You don't necessarily have to have a boring eating regimen, but you do need to make an assertive attempt to make sure that you're eating, every meal that you eat is somehow combating microplastics, toxic air, metals, right, and inflammation, right? A key thing, because all these things cause inflammation in the body, causes inflammation in the expansion of the fascia in your body as well, you know. So it's so much to be said right here. The visceral fat causing these different things. That's what the exercising is for. That's what the, you know, getting outside your comfort zone, changing your routine is all about. I talk about all about this in my book, and even in the children's book, because we must start with the children, right? So that's what we have to do, you know, help our children, help our mothers of our earth, and help the brothers out there, right, with testosterone, so we can have a thriving communities in the earth, right, as far as people goes and social society, right? We have to make a difference there. So listen, I just want to talk to you today about these studies are not something that we should just push to the side. I invite you, I'm going to put the links down below. I invite you to research for yourself, look at what you can do. Many of you have pre-existing health conditions, you're already on medications, but again, in my book, I already talk about how you can dial those things back as well, how you can reduce, eliminate, and incorporate with those things as well, right? Because the medications themselves are not just a medicine, right? It's 4 milligrams, 5 milligrams, 15 milligrams. It's also whatever medication that it is. It's also emulsifiers, dyes, and things that they don't have to even tell you that they're putting in the so-called medicine, right? So you have to really understand what's really going on. So again, Jason Bankston, man, I just wanted to come on and talk to you guys really quick. 3 top studies out there from the JAMA, the BMJ, and also the New England Medical Journal that you can look at for yourself, and giving you some key tips on how to combat these things, all right? As always, I tell you, pick up a copy for yourself, drop me a line. I'm open for questions. So, all right, links down below, goodgroundseed.com, and also amazon.com for the book. So I just thank you guys for coming out. We'll talk to you very soon. Hey, if you're interested in more information, click the link below to download my free presentation on 3 keys to immunity health wellness.